The Nigerian Centre for Disease Control (NCDC) says 104 Lassa fever deaths and 636 confirmed infections were recorded across the country in the first 2 months of this year. The agency adds that 70% of all confirmed cases of the viral disease are from Ondo, Edo, and Bauchi. In this report, Just Nigeria's Zainab Bala tells us why Lassa fever is a recurrent issue in Nigeria, the need for health authorities to take quick measures in controlling it, and how you can protect yourself.
It's a virus few people have heard of outside of West Africa. But for those who have experienced it firsthand, Lassa fever can be a terrifying and potentially deadly disease. Abbas Yusuf, Rabi Dahiru and Precious Oahonsi know this all too well.
I contracted the virus from my uncle while I was taking care of him.
I was tested at the hospital for malaria and other ailments. I was still feeling sick. I went back to the hospital and told them I was still feeling ill. I had stomach pain.
By what I was told, they said it could have been a contact with the Lassa rat.
Their stories are a stark reminder of the impact the viral infection can have on individuals, families, and communities. The Centers for Disease Control and Prevention (CDC) says there are between 100,000 and 300,000 infections in Nigeria each year, with around 5,000 of those infections resulting in death. From January 3rd to 30th, 2022, over 200 cases of Lassa fever were reported across 14 states and the Federal Capital Territory of Nigeria. 40 of those cases resulted in death. Fast forward to January 2023, and the Nigerian Centre for Disease Control (NCDC) says the situation has only become worse, with 109 deaths reported in 22 states. It's a concerning trend, especially for states like Ondo, Edo, and Bauchi, which have been particularly hit hard by the virus.
Studies have shown that the abundance or the presence of these Mastomys natalensis within some of these states are quite high compared to other states. So this then means that the chances and the ability for these Mastomys natalensis, these Lassa fever rats, to be able to infect other people or infect the population at large could also be more.
Irua Specialist Teaching Hospital in Edo State holds a special significance for Precious Oahonsi, who was treated here when he contracted the virus.
My case was a quite peculiar one because we didn't know initially that it was Lassa. So I was hospitalized I was admitted in a hospital. Then they started treating malaria also, giving me antibiotics and some malaria drugs. Then after 2 weeks, I felt a bit relieved, so I was discharged. But getting home that same day, I started vomiting again.
Bauchi State in northeastern Nigeria is also severely impacted by the Lassa fever virus. Abbas Yusuf and Rabi Dahiru live in Guyaba community in Kirfi local government area, where other residents regard them as heroes for surviving near-death experiences.
Because people who get admitted at the teaching hospital don't make it back, people became scared to tell others they have Lassa fever. I only told my wife.
My family were not happy when I was receiving treatment at the teaching hospital. They feared I will not make it back.
Health worker Isiaka Abdulaziz is part of the response team for Lassa fever patients at Guyaba Primary Healthcare Centre.
We had a lot of challenges before we were able to understand the symptoms of Lassa fever. When patients are brought here and we diagnose them, they don't listen to us. They don't agree they have Lassa fever.
On the streets of Lagos, Nigeria's commercial capital, how well do residents understand this viral disease?
I don't know about Lassa fever. I just hearing it.
Lassa fever is a virus that you get by exposing your food to rats.
Well, I've been hearing about Lassa fever, but I've never even seen a victim of Lassa fever.
I do not have in-depth knowledge about Lassa fever, but I know it's a disease.
Lassa fever is a viral illness that's primarily spread by the common African rat, and it's endemic in several parts of West Africa, including Guinea, Sierra Leone, Liberia, and Nigeria. The first recorded case of Lassa fever was documented in 1969, and the disease was named after the town in Maiduguri, northeast Nigeria, where it occurred. A person can contract the virus through contact with contaminated food or surfaces, or through exposure to the bodily fluids of infected individuals. Symptoms of Lassa fever can vary from mild to severe, and in some cases, it can be fatal. For those who contract the virus, the road to recovery can be long, with many individuals facing long-term health problems, such as permanent hearing loss.
Most people who have Lassa fever infection, they don't have symptoms. In fact, 8 out of 10 of the people who have Lassa fever will not show any symptoms at all. But the people who have severe symptoms, when they are treated, the fatality rate is a bit higher. Maybe 1 in 5 of them may die. Whereas in the general population, people who are infected, generally the fatality rate is no more than 1%.
Ministry of Environment has to play a role in the prevention of the spread of Lassa fever, in the sense that they need to have some design or devise some strategies to prevent or control the spread of the rodents in the environment, cleaning of the environment, and also Ministry of Health to do a Nigerian Centre for Disease Control to also have a collaboration to ensure that the infection prevention control measures are intensified.
So the technical working group in NCDC basically works to coordinate all Lassa fever responses within the country using the multi-sectoral One Health approach to attend to Lassa fever response and prevention activities within Nigeria.
Research is still on, but we don't have any vaccine for it presently. There's no vaccine for it. We believe with more research, and we've got the one for Ebola. And if we can get a vaccine for Lassa fever, it can be of help.
As it is, the battle against Lassa fever in Nigeria is far from over. And experts say government and other stakeholders need to do more to prevent the spread of the disease and save more lives. Zainab Bala, Gist Nigeria.